Why didn't my doctor wrap my head with a bandage and did not even ask me to wear a headband? I had otoplasty, and right after it was done, the doctor did not put any bandage on and instead just covered the incision area with some dressing tape to it. He did not even ask me to protect my ears with anything during sleep. I find it very weird and very unprofessional of him. I'm scared that I will not get the results that I want because of his method.
Thank you for your question. You submitted your question with a photo showing your ear after undergoing otoplasty with some what appears to be some steri strips, and you're stating in your question that your surgeon didn't put any kind of bandage after your otoplasty and did not provide any particular guidance as to how to protect the ear during sleep, and you feel that your surgeon was being unprofessional, and you're concerned that the lack of certain aftercare instructions that you have obviously researched is not going to allow you to get the final result that you desire. Well, certainly I can give you some guidance as to how I do otoplasty and what my general approach is and why I do things the way I do, and that can maybe help you in the context of your surgeon's approach. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Otoplasty of different types is something we perform in our practice, and I have certain aftercare approaches that I will share with you to give you some sense of why I do it this way, and also help you with some perspective as why your surgeon may have chosen a different way. So to begin with, we'll start with the fear that you have about your surgeon's level of professionalism. I think it's premature to cast this kind of judgment of unprofessional upon your surgeon. I think that we all, as surgeons, have our own styles based on our own experience. And to give you an idea of what I mean by this, when I was in training and learning facelifting surgery, I had one preceptor who, after facelift surgery, had wrapped the patient in so many different bandages and put multiple drains, and then put essentially kind of like a plaster cast over the head. And the next day after surgery, we would have to take all that apart and pull drains and do all kinds of things. Well, although certainly my preceptor had his justification, but in my own practice, in the way I do my facelifting surgery, I changed the way I did my dressings to match the way I did my surgery. So when it comes to otoplasty, there are basically one significant concern, and that is the accumulation of blood and fluid in between the skin and the cartilage. And to reduce that risk, we place some type of a compression type of dressing for the first 24, 48 hours, and then change that dressing. And typically, once I see everything is clear, then I'll have a patient wear something like a sports headband, especially when going to sleep, to try to minimize the risk of the ear bending in the opposite direction, putting some stress on the healing of the areas where there are sutures and raw edges that are still healing. So that's basically, I think, the general idea and philosophy of a lot of my colleagues. Now, that being said, in your situation, your surgeon may have done a dissection which they felt was very clean, that did not appear to cause them concern, and maybe from experience they've decided that, generally speaking, putting some steri strips is adequate, and it's a matter of that doctor's personal choice. I think that certainly it is very important for you to have this dialogue with your doctor. It is likely that you chose your doctor after seeing before and after examples of the doctor having performed otoplasty, and you've made the decision just the way I think most people do when they choose their doctor, is based on that doctor's experience and relative expertise and mastery of a particular procedure. So I think that if your doctor has a rational justification for their approach, then that's part of the dynamics of trust between a doctor and a patient. Now, if the doctor may decide to help you maybe feel a little more secure and do something such as wearing the sports headband at night, that's part of the synergy between a patient and a physician. So I think that, again, to restate that it's premature to say that your doctor was being unprofessional. I think, again, an individual doctor's style hopefully is reflective of their experience. And I think that you can certainly get a lot more clarification by having this conversation directly with your surgeon. So I hope that was helpful. I wish you the best of luck, and thank you for your question.